you're worried about seeing a psychiatrist or a new psychiatrist, and I will tell you that this is completely natural and normal and common. So, I am going to walk you through what it looks like to see me for the first time and what your treatment course could look like. If you've been thinking about reaching out to a psychiatrist, but you haven't quite gotten there yet, that hesitation makes complete sense. A lot of people don't know what to expect. They don't know what the first appointment's going to look like. And not knowing can really feel like a barrier. It does become a barrier. Is it going to be uncomfortable? Will they listen to me? Will we get along? Will they just hand me a prescription and send me home and tell me to come back in 3 months? And what will I be asked? Do I have to talk about things I'm not ready to talk about? Will I cry? Will that be embarrassing? I hear these questions all the time. So today I'm going to walk you through what it looks like in my practice. And if you've been on the fence, you know, or at least you have a better idea of what you're walking into. And I'll tell you up front, it is probably not like what you imagine or what you fear. My initial appointments are 90 minutes long. And I know that might sound like a lot, but I want to explain why because I think it will make sense once you hear it. My goal for the first appointment is not just to check boxes on a symptom list, it's really to get to know you. And of course, it's important to know what your symptoms are, but it's also really important to know who you are, what your life looks like, what has and hasn't worked, and what matters to you. Also, things about your lifestyle and your sleep and your relationships. That kind of picture takes time to build, and it's really important to inform what's going on with you. Once I have time to build that, the treatment plan we come up with is so much more useful than often what you can come up with in a shorter appointment. So you often can leave the longer appointment with more clarity about what's going on with a really solid plan. And it's not just a prescription and follow up in 3 months. So, first, we'll start with usually what brought you in. I'm going to ask you a lot of questions about your symptoms, and we really dig into them and the details and the specific, not just kind of how's your mood on a scale from 1 to 10. We will talk about your mood and whether you're feeling depressed, anxious, irritable, or some kind of combination or something else. We talk a lot about sleep, how you're falling asleep, whether you're staying asleep, what happens if you wake up in the middle of the night, how well rested you feel when you wake up. We talk about your energy level, your appetite, your ability to concentrate and focus. We talk about whether you're experiencing worry or fear and what that looks like for you, or whether it's constant or comes more in waves or episodically. And then we talk about physical symptoms that might feel connected, like headaches or heart palpitations, chest tightness, stomach issues, fatigue. If you're having panic attacks, we'll talk about those and what seems to trigger them, if anything. I always ask about feelings of hopelessness or thoughts of self harm or wanting to take your own life, not because I expect that to be the case for everyone, but because it really matters. And the first priority is keeping you safe. The more detail that we can get into, the better it is, and the more helpful it is to come up with the most accurate diagnosis. And you don't have to be organized in advance. That's my job. You just tell me what's going on, and I ask the questions to kind of fill in the picture and figure out the follow-up questions. We'll also spend time on your history, like your medical history, any conditions you've been diagnosed with, medications you're taking, and then, of course, more detail about your psychiatric history. If you've ever seen a therapist or a psychiatrist before, if you've tried medications, which ones, for how long, if they worked, if you had side effects, maybe what the hardest part of your life was and how you got through it. And then we'll also talk about your family history because mental health conditions tend to run in families, and knowing what your mother struggled with or your sister has been treated with can actually be really useful clinical information. And then, of course, I want to know about your life, not just your symptoms, but who are the most important people in your life? What do your relationships look like? What do you do for work? How's it going? What are you interested in? What lights you up? What are you proud of? What keeps you going? And then I ask about your lifestyle too, what your sleep routine looks like, what you're eating, whether you get to spend any time outside, whether you're moving your body and in what ways. And it's not just small talk. There This is really important information for the whole clinical picture, and they also shape the treatment plan. I really want to get to know you and not just your diagnosis. The best treatment plan is one that's built around your actual life, not just a generic protocol. The treatment plan for each of my patients is very individualized. So then by the end of the evaluation, we'll talk through what I think is most likely going on, the diagnosis or the working diagnosis, because sometimes we are refining our understanding over time. But I walk you through my thinking because I think that you deserve to understand the reasoning and not just hear a label. And I think it's helpful also to come up with a diagnosis because it helps you understand what's going on. Narrowing down the diagnosis matters. It shapes the treatment. It's very important to understand how we treat what's going on. Depression and anxiety overlap a lot, but they sometimes call for slightly different approaches. PMDD, for example, has specific treatments that work better than others. If you're in perimenopause, those hormonal fluctuations are often the key to getting the full picture. And getting the right picture makes the plan much more targeted. And then we build a plan together. And I do mean together. This isn't something I hand you and order you to do. It's a conversation about what makes sense given your specific situation, your values, your preferences, and your own life. And of course, I give my recommendations, but it's more about informing you about the best tools that are most likely to help you thrive. And then you can make an informed decision about your treatment. It's your body, it's your life. You decide what to do. It's my job to come up with the information that you need to make that decision. So the treatment plan may include any combination of the following: psychiatric medication, and things like antidepressants, SSRIs or SNRIs, sleep support, anti-anxiety medication, sometimes stimulant medications for ADHD. And I explain clearly what the expectation is for how often you need to take them, how long they'll take to work, what the potential side effects are, and how to manage some of them. We may also talk about psychotherapy, whether that's with me or with an outside therapist. I almost always order blood work or lab work because I think it's really important to rule out any underlying medical conditions like thyroid function, iron levels and ferritin, vitamin deficiencies like B12 and vitamin D, your blood sugar, and the list goes on. That list isn't exhaustive. A lot of these things are common and also very treatable, and they frequently drive or worsen psychiatric symptoms in ways that can sometimes go unidentified for a long time. We might also talk about hormone therapy. If you're in perimenopause, we'll talk about whether menopausal hormone therapy belongs in the picture. And this isn't just for hot flashes, but for mood, sleep, cognitive clarity. We may check hormone levels if it would be helpful, but also normal lab values don't mean hormone therapy won't help. If you're pregnant or breastfeeding, then we'll have a really thorough conversation about the risks and benefits of treatment versus the risks of not treating. Really, it's a risk-risk discussion, the risk of medication versus the risk of not having treatment. But this is so you can make a really genuinely informed decision about your own care. We may also talk about evidence-based supplements like magnesium or omega-3 fish oils, maybe creatine. I have a full episode coming on supplements, so I'm not going to go too deep into that here, but these are clinical tools and they're not just kind of wellness extras. They can be helpful to support mood and anxiety and sleep problems. We'll talk about movement, sunlight, nutrition, specific personalized recommendations that really fit your lifestyle. And then we talk about integrative modalities like yoga or acupuncture, sometimes breath work, and all the evidence that supports your specific situation. So this list is long, but it's also not exhaustive. And sometimes it can feel overwhelming to hear about all these things that you could do or that might be helpful. And so I just try to remind you that this is like a menu of options. And we talk about things that are going to probably move the needle the most, and then some other things that can help support all the other treatment that you're doing. We take things one step at a time. It's kind of a step-by-step process. I don't like to start too many things all at once because then you don't know what's helping or what's hurting. So after the initial evaluation, we schedule a follow-up appointment, and that's usually within about a month, sometimes less. In the beginning of treatment, we stay in relatively close contact, typically meeting at least monthly until you're feeling genuinely better. tends to happen somewhere in the 3 to 6 month range for most people, although it can vary. And then as you stabilize and really thrive, appointments get spaced out further. The follow-up appointments are usually at least 25 minutes, but they can be longer if we need to. And sometimes we'll bring in a family member for a longer appointment for a family meeting. I don't believe in the rushed 5-minute check-in for a medication refill. It's just not comprehensive care. You really deserve a full, thorough conversation when you come in. Between appointments, you can reach me through a secure patient portal or a messaging app, and I respond personally and in a timely way. My patients tell me that just knowing they can ask a question and get a real answer without waiting weeks for the next slot makes a really meaningful difference in how quickly they start to feel better. And I agree. I think that can be really helpful. Questions come up between appointments and they shouldn't have to wait that long. In my practice, I keep insurance out of the equation so I can give you more time, more access, and a level of care that actually fits your life and really helps you thrive faster. This gives me the flexibility to do the work that what I think is the right way. That means longer appointments, real access to me between visits, and a treatment relationship that isn't constrained by what an insurance company wants us to do. I know that's not the right fit for everyone, and that's okay, but for the women I work with, it does make a real difference in outcomes. So if any of this resonates with you, here's what the first step can look like. I offer a free 15-minute intro calls. It's really a meet and greet. You can schedule that directly through my website. There's a book a consult button, and there's a calendar at the bottom of the homepage. You can ask me questions, get a feel for who I am, how I work, and I hear a little bit about what's going on for you and whether I'm likely to be a good fit for what you're looking for. That call has no obligation. There's no pressure. But if after that conversation you want to move forward, I'll get some basic information. I add you to my patient portal. You will get the consent forms, and then we'll schedule the initial evaluation. The whole process is pretty straightforward and not very cumbersome. I see patients in person in my office in Linwood, New Jersey, which is in the South Jersey area, and I also offer telehealth throughout all of New Jersey and also Florida and Texas. So wherever you are in those states, care is available. The link to book an intro call is in the description below. You can also find it on my website, elementalintegrativepsych.com. So if you've been thinking about this for a while, which is really common, and you're just waiting for a sign, then take this as your sign to get started. Getting started is definitely the hardest part. Next week, I'm talking about how a holistic treatment plan gets built and how all of those pieces come together into a single individualized approach. So if you want to understand the full picture of integrative psychiatric care, that's the one to watch. If you want to know more about reproductive or integrative psychiatry, I have other videos on that, but here's the video for integrative psychiatry if you're interested. I'll see you next week.